In my 7 years of experience of working as a fertility specialist in India, I've obviously realized that there is a huge demand for fertility services, and more and more people are coming up front seeking services for not being able to conceive. If we go by the book, the definition of infertility or subfertility, as we call it now, is any couple who's been living together without using contraception for a year and not had a baby or not conceived falls into the category of a subfertile couple, and these are the couples that ought to seek treatment from a fertility specialist for their problem. Now, the scenario of infertility or subfertility worldwide seems to be changing. It's no longer a social stigma. It's not a disease you have to hide. It's not an issue you don't want to talk about with your friends or your family. It's a medical disorder which needs attention like any other medical disorder, and more people are accepting this, and more people are forthcoming seeking treatment options for infertility. Infertility or subfertility can be because of either partner, male or female, and nearly half the causes come from the female partner and half from the male. So, it is basically looking at disorders of both the male and the female, which sort of gives you a clue as to why the problem occurs. Multiple disorders in females like polycystic ovaries, endometriosis, tubal blocks, hydrosalpinx, fibroids in the uterus, poor ovulation, early menopause, they form a myriad of issues which can result in infertility in females. In men, it's usually low sperm counts, absent sperm counts, or ejaculatory dysfunctions which add to the male factor of infertility. The good thing is that all problems are treatable, whether it's a female factor or a male factor, as long as you are forthcoming to accept treatment options. Treatment options are available for all problems, ranging from basic ovulatory drugs to basic drugs to increase the sperm count, laparoscopy and surgically corrective disorders for infertility, IUI, IVF, ICSI, surrogacy, gamete donation. All options are now easily available and are becoming more and more acceptable to people. So, there is actually no part of infertility which now remains untreatable. So, all you have to do is to find a doctor close to you who is accessible, whom you are comfortable with, and is qualified to deal with infertility issues, and carry on and find a solution to your problem.